My question is to Dr. Tedros. Doctor, it's exactly 1 month today since the Ethiopia-Tigray peace agreement was signed in South Africa, and several weeks since the Nairobi Declaration in Kenya on the implementation. As far as the access to Tigray is concerned, can you please give us an update? Does the WHO now have access? Has the peace agreement changed anything on the ground for the people suffering there? Thank you.
I think Dr. Ryan will answer that initially.
Thanks, Simon, and thanks for your continued focus on really desperate situations in sometimes forgotten parts of the world. The announcement of the negotiations on ceasefires and peace process is obviously welcome. The Director General has always said that we need peace to have health, we need health to have peace. So any cessation of hostilities that allows us to address the health concerns and needs of the population must always be welcomed. But that peace process has not yet resulted in the kinds of full access, unfettered access, and in the massive scale-up of medical and health assistance that the people of Tigray need. There are issues in Tigray, particularly with militias in the west who control parts of the territory. There are still significant parts of the country that are occupied by Eritrean forces for which there is no access, and very disturbing reports emerging around the experiences of the people there. There are areas, certainly in Tigray now, in which the Ethiopian Defence Forces are, but other areas in which other Tigrayan forces are. So it's a very mixed bag, and certainly we are seeing some increase in access in terms of getting some of our staff in. We've had a small allocation of fuel from that will allow us to do some operations, and we're starting to see a small trickle, and I would say it's a trickle. We have a tiny percentage of the need that's there potentially we can meet. There are some areas in which there is access for assessment teams, but as regards bringing back online the health system, as regards resupplying primary healthcare and secondary healthcare facilities with essential medical equipment, as regards paying health staff, as regards communicating and being able to effectively use their banking system, which is still completely offline. So without mobile communications, without a banking system, it's horrific for the people there not to have that. So many years in, not to have access to your own money, not to have access to communications with loved ones. But it is critical in an emergency operation to have those systems. So much of the success of humanitarian response depends on logistics, depends on communication, depends on banking systems. If they don't exist, you don't have the means. Now, we are trying directly with bringing cash in. Well, I think the last cash allocation we wanted to bring in, we were only allowed to bring in half of that cash. So it's half of this, quarter of that, a tenth of the other. So it's really hard to plan a scale-up when at every moment you can have your ambitions curtailed. So the UN system, I believe, is really anxious to scale up our operations. We welcome, and let me say that again, we welcome any cessation of violence, we welcome any access that's given, but the people in Tigray are desperate. They've been years now without access to proper healthcare, without access to proper nutrition. And they need our help now, not next week, not next month. They need it now. And I still, personally, and my team, do not see evidence of unfettered access to the people in need in Tigray. That needs to change, and that needs to change soon. We hope that some of this is just the beginning to wind up the aid system again, but I have to admit I remain cynical on that front, because we've been a long time waiting to get access to these desperate people. So I hope, I still live in hope, but I can't report good news on that. But we will continue to try, and we will continue to try and do our jobs on behalf of all the people of Ethiopia and those in Tigray. Thank you.